All right, diabetics whose blood glucose levels are poorly controlled could be at risk for major tooth problems. Dr. Charles Martin joins us this morning to talk about how diabetics can protect their pearly whites from falling out, it says here. Is that right?
Diabetics have more of a challenge with their teeth than most anyone else.
Really?
Yes. In fact, it's a situation where poorly taking care of teeth can cause a diabetic condition to get worse, and vice versa. The diabetic condition causes the teeth to get worse.
So it's just kind of a rolling cycle.
Yeah,
there.
it's a downward spiral together, unfortunately, Bill.
Let's talk about the special problems here. Okay, so if they're not taking care of their teeth, it makes the diabetes worse, and the diabetes makes the teeth worse. Where do we start on this?
Well, clearly, if you can get your diabetic condition as good a control as possible, you're better off. Mm-hmm. But not treating your teeth, not taking care of your teeth on a regular basis makes it worse, and here's why. You can't get your diabetic condition under control.
Why is that?
Because if you have a low-grade infection, and see, when your teeth aren't in good health, it's a low-grade infection. It throws off the body's ability to control your blood sugar levels. So by getting your teeth in good health, you enable your own system to get better, and the medications that you're taking, if you are taking medications, to do their thing, so to speak.
Okay. So you always bring some great before and after shots here, and I understand we have one here too.
Right.
Okay. There's a lady, obviously a huge difference here.
Yes.
Now, was this lady a diabetic?
This lady was not a diabetic.
Okay.
I use this to illustrate what can be possible for people, because so many people feel like that there's not a whole lot can be done. Actually, there's a whole lot that can be done. And for this person, it was a renewal to how she felt about herself, and she felt like her teeth were making her look older than she actually was.
Well, in that photo, she does look older in the before, so obviously it worked very well. We started off by saying something about death and your teeth falling out. Let's go back to this diabetic situation with it can spiral into something very serious.
Well, obviously, I mean, in the news recently was a 12-year-old boy that died from a dental infection. So, as we know that a dental infection can cause serious problems, diabetics have a harder time with their gums, and it's because of the circulatory system. The diabetics, traditionally will have, as the condition worsens, they'll have trouble with their feet, their kidneys, and their eyes. It's also true they'll have trouble with their teeth.
We've had a lot of people, and we've heard a lot about diabetes, and obviously it's a growing problem with our population as we all tend to put on a little bit more weight. Couple of simple steps that people with diabetes can do to protect themselves and their teeth.
Well, first of all, they should know what their A1C level, which is the best measure of how their blood glucose levels are being controlled. You can do a morning thing, but your medical doctor needs to do your A1C level, and you need to know what that number is. Generally speaking, between 6 and 7 is a good number. It's the out-of-control diabetic that we're really worried about. And a lot of people are out of control. Now, what's disheartening for us is that about 1/3 of all diabetics don't know they are.
So you can't get it in control until you
don't even know what the condition is.
You've got it and then start dealing with it.
Exactly.
Dr. Charles Martin, always good to have you on board.
Thank you.
Thanks for the information. I always learn something when